Welcome to The Nation. I'm NADIAH Abdul. On the 27th of August 2025, the Ministry of Health unveiled Malaysia's first National Rare Disease Policy, a milestone that for the first time defines what rare diseases are in our country and sets path for global action. Today, globally, rare diseases affect more than 300 million people worldwide. In Malaysia, it is estimated that over 1 million people live with rare conditions. Yet, most families wait 5 to 7 years before receiving a diagnosis. Now, to help us connect with the global story with the regional and the national journey, we're joined by ALEXANDRA CEO of Rare Disease International, and later Monica Ferrie, Executive Director of the Asia-Pacific Alliance of Rare Disease Organizations. Thank you for joining us, Alex, all the way virtually from Geneva, Switzerland. Ça va bien? I hope you're doing well today.
Thank you very much, Nadia, for inviting me. I'm very well, thank you.
Let's start with the global perspective. When we know that soon or recently, Malaysia co-sponsored the World Health Assembly resolution on rare diseases, and this was announced in May 2025. Congratulations, RDI, and all of the countries that were involved. Now, why was this resolution so historic, and what does it mean for countries like ours?
The World Health Assembly resolution adopted indeed in May this year recognized for the first time rare diseases as a global health priority. For Malaysia, which was a leading country in the process of the adoption of that resolution, that at the same time adopt its first national rare disease plan, it really validates that the country's leadership and commitment on the world scene. So this is a huge accomplishment for Malaysia.
Now, the next step of the Global Action Plan, we know, of course, is bringing that action into the regional and national perspective. So when can the world expect this Global Action Plan? What kind of commitments will nation be expected to commit to, especially for Malaysia? What are we trying to ask countries to do, and what are some of the key action pillars that we are looking at prioritizing?
So the Global Action Plan is one of the demands that is part of the resolution on rare diseases. There are other also demands for member states to do in that resolution, notably adopting national plan, like just did Malaysia. But the Global Action Plan, it's a request, it's WHO, so it's the World Health Organization that has to develop, in consultation with every stakeholder, that plan. It will take 2 years to develop, and it will have again to be adopted by the World Health Assembly certainly in May 2028. And again, it's member states that will have to decide the adoption of the plan. But during that time, civil society and all stakeholders can play a critical role by notably ask for what is critical for that plan to have. And it could be really multi-sectoral action. It shouldn't be only on health. We know that rare disease go beyond health. It will be certainly about integrated care, how rare diseases are going to be integrated into the healthcare system, into primary healthcare, etc. And it will be, and we will have to call for that, really about person living with rare disease, also engagement. We have to be part of this consultation. And if I'm correct, actually, all those elements have been reflected in the Malaysian new adopted plan. So Malaysia can really play a role in leading the path. So this is the process. And the other process that RDI would really ensure with all the regional alliance and all our members across region is that plan shouldn't be a top-down approach. It should really come up from the realities of every region. So we want to make sure that that plan reflects the different realities across the world.
Wonderful. I think you mentioned some very important points there. Matching the realities on the ground and, of course, integrated care. Now, we know that some countries already have a rare disease strategy or a policy or an act, and others are still lagging. We know that, for example, in the EU, we've got quite a number of countries that already have a national rare disease plan. We know that looking at this particular region, Japan was one of the pioneers. South Korea has had its act by 2016. In ASEAN, Malaysia and the Philippines are actually one of the two countries that have a specific national action plan and, of course, policy on rare disease. Of course, other countries have got different things. In Singapore, we have no formal national rare disease policy, but there's a very strong focus on access programs and, of course, advancing genomics, etc. So while we're looking at a very varied global landscape, some countries are ahead, some countries are less so. How do you see Malaysia positioning itself in the next few years, especially in the lead up to 2028, when you said that we are looking at a global action plan? What are some of the unique characteristics of the first policy that we now have?
I think it's indeed every country has different level of advancement. And I would say that having a national plan, it's critical, but often it's not the only thing to ensure that we respond to the needs of the communities. There is much more. There is need to have registries as well. That there is a cross collaboration across different regions. And I think even though country can have a national plan, there would be the opportunity with the process of developing the global action plan and adopting it, many other opportunities for enhancing what is already there. So it's about identifying the gaps that are still there in certain countries and see how the global action plan can leverage or can fill those gaps. So most importantly, that global action plan should be seen as a framework, as a guidance for country as well. We believe that it will be quite detailed. There will be also action for every different stakeholder, not only for member states. We know how much multi-stakeholder approach is required to address the needs of persons living with rare disease. So the pharmaceutical industry will have to be involved, our patient group will have to be involved and work together. This is what provides that plan, an opportunity to leverage what already exists or fill the gaps and enhance initiatives that have worked in different regions, because we have a lot of examples of initiative that works. So it will be about how we scale up them. Which one do we scale up? It will be that process that we will have to have. But as I said, a national plan is a starting point, but we have seen often countries that have national plan but still have a lot of gaps, because as well, finance, the budget is often an issue behind.
Definitely, and we've seen this over and over again. Now, you mentioned several very important points. You said that all stakeholders need to be involved. And RDI is also at the forefront of ensuring that there are conversations not just with member countries on why rare disease is a health priority and a human rights priority, but also how do we enable regional patient actors as well as the industry to cooperate to move the dial. You mentioned very correctly about the access to medication, innovation in terms of pricing. So what are some of the things that we're looking at moving forward in terms of how industry can be at, well, I suppose, at the table from the start instead of at the receiving end of how things are going to be?
We hope that during the development of the global action plans, there will be consultation for sure. So we hope that there will be also an opportunity to set up some task force or some working group driven by the World Health Organization that will bring all the different stakeholders around the table and really look at some very concrete solutions. We don't want to say only about principle, about what should we do, because I think we all almost know what should we do. It's about how do we do it. What is the most important action and solution that a country with all the different stakeholders can already implement to address some of the major needs of the population? As I mentioned earlier, I think it's about identifying some very concrete solution that can be scaled up and tailored to the different region and country. And by having that process, stakeholders will have to work together in a formal, I would say, process. So yeah, there will be discussion and there will be more commitment and formalization of those one.
Looking forward to that, Alex.
Yeah.
Now, in 1 minute, What are some of the things that you hope to see perhaps Malaysia do? Maybe one or two benchmarks that you hope to see in the next 5 years or so. And finally, as someone watching from the outside, what are some of your reflections on where Malaysia can head en route to 2028?
So, for example, this resolution on rare disease, which will lead to a global action plan, one of the core elements, it's increasing universal health coverage and making sure rare disease are integrated in the universal universal health coverage. So one of the two benchmarks that Malaysia could really see in the next 5 years, it's having more access to essential diagnoses and therapies. This is what we need, and also we could see another benchmark. It could be a fully operational multi-sectoral approach. I know it's in the plan, and this would be really critical because we will be able to also tackle the social support that often, most of the time actually, our community needs beside health and mental health as well. It's a core element. So this could be the two benchmarks. And then about the reflection from an outsider about the Malaysian really role, and I think Malaysia, since I've met, I remember 3 years ago, almost, or 2 years ago, the Minister of Health in Malaysia, we could see the commitment to really find a way to address the needs of the community in Malaysia of rare diseases. And I think in rare disease, we need political will and leadership. And I think Malaysia, it's a real example of that. We know that there are challenges and needs, financial needs, but at least there is the political will, and I hope this will really show the path for other countries in the region.
Definitely. You said political will and leadership, and hopefully we're definitely looking for that. Alex, it's been a pleasure having you all the way virtually from Geneva. We hope to see you again in Kuala Lumpur very soon in the near future. Now I'm off for a quick commercial break. Monica Ferrie is waiting on the line, Executive Director of the Asia Pacific Alliance of Rare Disease Organization, will join me right after this. Stay with us.
Malaysia Madani adalah panduan, ikhtiar holistik dan dasar pentadbiran yang berteraskan kasih sayang. Ia bertunjangkan sikap saling menghormati, meraihkan kepelbagaian dan pendapat. 5 jari dengan jalur merah putih merupakan simbol rukun negara. Bulan sabit melambangkan Islam sebagai agama persekutuan. Bintang berbucu 14 menandakan perpaduan 13 buah negeri dan wilayah persekutuan. Bulatan biru menzayakan kebulatan muafakat dan perpaduan rakyat. Warna biru bermaksud kesatuan nasional, keterangkuman dan persaudaraan. Kuning, nilai tradisi, kebudayaan dan kearifan tempatan. Merah, keberanian, jati diri dan keazaman. Putih, keluhuran budi, kesucian hati dan hasrat murni.
Welcome back. I'm now joined by Monica Ferrie, Executive Director of the Asia Pacific Alliance of Rare Disease Organizations, who joins us virtually from Canberra, the capital of Australia. Thank you for joining us, Monica.
Hello, Nadia. It's lovely to be with you.
Now, let's start first from what is APARDO? It's a mouthful, another acronym. Can you tell me what the Asia Pacific Alliance of Rare Disease Organization is, and why does it matter in this region?
So APARDO is an organisation that's existed for 10 years. This year, it's our birthday. And it is an organisation that is totally committed to convening and bringing together the patient voice and the community voice across the Asia Pacific, and ensuring collaboration with all of the stakeholders that are able to influence the quality of life for our community, and that's the rare disease community. Our members are our patient organisations representing amazing groups of people living their lives the best they can, and we want to support them to do that, and we want to support the patient organisations to be able to support their communities as well.
And you know that Malaysia has just recently unveiled its first national rare disease policy. Thank you so much, APARDO, for also posting on the effort that was done at Parliament Malaysia just a few weeks ago, in fact. So from your perspective, what does this milestone actually mean for a country like ours and in the broader sense, the Asia-Pacific landscape?
Well, firstly, congratulations. I know it's always such a large ask and task to set out on. So congratulations to all Malaysians, to all of the stakeholders who contributed to the development of the plan. I think plans are super important, but plans are dreams unless they're implemented. So it's now, you have a wonderful pathway, a wonderful guidebook on the path that you intend to go down and to implement. So to implement, that's going to take, it's going to take human collaboration between all the stakeholders, but it's also going to take structural collaboration between the systems that matter and the all of the different the different infrastructure pieces, the data, the hospital systems, the laboratories, and more, that the disability services and more, that we'll all need to come together to successfully implement that plan.
Definitely so. And I think patient organizations are at the heart of APARDO. And we've seen how different countries have engaged their policymakers as well as their ecosystem in how they've done things. For example, Philippines definitely at the forefront of working together, not only with the Ministry of Health, but with university students and academia research in trying to push things forward. We see the same thing coming out of Thailand with its Act on Rare Disease. And then, of course, now, while we do have all of this affirmative action coming out of ASEAN, how do these groups actually keep policymakers accountable? Because as you rightly pointed out, it will be dreams without implementation. So how do we ensure that commitments actually translate to actions on ground? And perhaps give us a sense of how Australia has been able to do that.
Well, I think firstly, implementation is a partnership. So when we talk about the patient community keeping all the other stakeholders honest and accountable, that's a reciprocal relationship. So I think it's really important to start that way, to say we're all in this together. We will all hold each other accountable, and that means transparency. That means communication. That means a real appetite to work together to deliver the plan. And sometimes that's easier than others. It always gets hard because it's not possible to satisfy everybody and every stakeholder all of the time. And that's okay. What needs to happen is that if you can't do it this time, then what's needed to make the patient community feel safe, feel confident and supported to be able to make it happen next time or in the future at some agreed time. And I think
that phased approach that you're saying is extremely important, Monica, especially in trying to understand how, in a country with so many health priorities, you're going to prioritize, is it access to medicine, is it newborn screening, is it support services, knowing that perhaps, you know, less than 5% of the total rare disease population would actually have any kind of access to medicine, and the rest are actually down to either screening and support services. So what lessons have you learned, at least for APARDO, in the last few years in what to avoid? What are some of the pitfalls that we've seen other countries have actually had to learn from that Malaysia can also take heed? We don't have to mention countries, but what are some of the things that are absolute no-goes? We should not be going down that route. Any thoughts?
I think there's a few, and some of those are my Australian experience. So I'm happy to name countries. I think Australia is a country that's been, and quite rightly, driven by evidence and by research. We do that really well. The challenge of that is ensuring that you don't recreate the same evidence to prove the same things when you already have the data, you already have the knowledge. Australia has a federated health system. So we have national policy and we have state implementation. And many health systems have many different players that collaborate to deliver health and wellbeing to their populations. The challenge around that is when they get in each other's way. So rather than a collaborative effort that says, we're all on the same team here, we all want to deliver the same outcome. How do we do that? And then work on the how. We can, and as can many other countries, get overwhelmed by the barriers. Data is one of those barriers that Australia has really struggled to overcome. How we share data, how everyone collects data the same, so then it becomes a national resource that can be used to understand what we need to do to be better delivering our health and wellbeing services to our communities.
What I'm hearing from what you're saying is essentially, number one, avoid redundancies when the data already exists. And when the data doesn't exist, how might we then look at creating a structure that is mutually accountable, mutually beneficial, holds the mirror to each other, and ensure that the data that is being collected are data that can be used, can be shared, and has the ethics in place to ensure that actual action can be implemented. I think we're going to see quite a lot of that in all of the different countries. Now, circling back on the fact that Malaysia is chairing ASEAN, Monica, we do want to drive stronger regional agenda, and of course UHC or universal health coverage is one of the things that we're pushing for. What are perhaps maybe one or two practical steps that you believe Malaysia can take while chairing ASEAN, at least in the coming 12 months?
Well, I think one step that Malaysia has already taken is leadership through launching its rare disease plan, and being able to collaborate with ASEAN to see these are common themes that exist across a range of the ASEAN countries, and indeed further across the whole of the Asia Pacific. It's what can be learned from local implementation, I think, that becomes really important. If we can create learning health systems and have experience feed into those learning health systems, then countries will not repeat the same or find themselves in the same position as other countries that have already solved that problem or already managed to find a different way.
Definitely. And I think one of the things that the Ministry of Health of Malaysia has mentioned, that this is going to be a multi-ministry effort, because rare diseases in Malaysia is not just a health issue. We're seeing it as a human rights issue that cuts across, needs the collaboration of multi-ministry, and the shift of the narrative is about how every Malaysian living in Malaysia and abroad would and should have a life well lived, irrespective of what complicated medical condition that they may have. And of course, the proof will be in the pudding of whether or not this is going to be implementable. Now, before we close, I know that APARDO is hosting a conference in November, and this will be hosted in Indonesia. Could you tell us a little bit more about what you are expecting and how this then leads up from the session that was hosted in Malaysia in 2023?
So thanks, Nadia. Yes, we are super excited to be heading for Jakarta in Indonesia at the end of November, and bringing together the rare disease community of patient groups, of industry, of policymakers, of health professionals, of anyone else who has the ability to influence the quality of life of our communities. And what we really are seeking to do from our meeting in Jakarta is using the WHA resolution as a springboard and launching pad to say, what do we need to be doing at a local level? What do we need to be doing at a regional level? What are those regional commonalities that we can work together on? And where do we need to be supporting at a national level? And we want to drive out of our conference in November some networks and some task forces to actually begin that collaborative process or continue it in some cases.
Wonderful. Thank you so much for your time and your insights, Monica. Definitely, we look forward all the best for the November APARDO conference, and we look forward to our next conversation. Now, ladies and gentlemen, before we end, we have a special message to share with you from the Ministry of Health, that is Dr. Zulkifli Ahmad, and this is what he has to say.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, salam Malaysia Madani. Malaysia has taken a historic step forward with the launch of our first ever national policy for rare diseases. This is more than just a policy. It is a commitment to Malaysians whose conditions may be rare, but whose needs are very real. Rare diseases affect fewer than 1 in 4,000 people, yet the journey to diagnosis and care is often long, uncertain and lonely. Globally, there are up to 8,000 rare conditions, but only a small fraction have approved treatments. This is why we must act. Our policy rests on 5 pillars: early detection, fairer access to treatment, stronger research and innovation, building clinical expertise, and establishing a national rare disease database. With this, we aim to shorten the diagnostic odyssey, bring families closer to answers, and ensure no patient is left behind. Behind every statistic is a story of courage, a child, a parent, a family. To them, I say, this policy is our promise. You matter, and you will not be forgotten. Together, we can create a healthcare system that is inclusive, equitable, and compassionate, where no Malaysian is left behind because their condition is rare. I thank you.
That's all for this edition of The Nation. I'm NADIAH ABDUL. Thanks for watching, and stay with us for more conversation that matter.